Hi, I'm Kelsey Boss, Doctor of Physical Therapy, founder of Compleo, here to talk to you about taking care of your body throughout pregnancy, which can look different for each trimester. And so this is one of the reasons we have a whole team on our staff, because nutrition looks different in different trimesters, where our perinatal dietitian comes in. Movement can look different, which is where our pelvic floor therapists come in, and preparing for baby can look different in each trimester, which is where those of us like me who just love playing with babies and pediatric therapy come in. So those early weeks, which are sometimes the hardest and sometimes the times where you haven't fully announced your pregnancy, so you're trying to go about life as normal but feeling pretty miserable. Listen to your body. Don't be scared to rest. Take it easy, but listen to your body. So if you feel great, keep working out. Don't feel like you have to lay in bed all day. But during that first trimester, that's where a lot of that morning sickness may come in. That's where nutrition is going to be really, really important, because your baby is really forming a lot of foundational parts of their skeleton and of their body and organs. So making sure you have that good prenatal supplement with that folic acid, that has to start as early as possible. Really, if you're considering kids, you should be on that prenatal vitamin. Then as you move into the second trimester, this is where no pregnancy is the same for everyone, but generally speaking, you start to feel a little bit better. You get that energy boost. So that second trimester is a great time to maybe take a trip, see some family, do some nesting at home, get things organized and ready. That second trimester, early third trimester. And then towards the end of the third trimester, and I am speaking from experience right now, I went as hard as I could the past 37 weeks, and I have hit 38 weeks, and my body is feeling it. And you need to listen to that. So making sure you're really paying attention to sleep positions that are going to help your body as you get further in your pregnancy. That's where your pelvic floor therapist can help you figure out the right pillow placement. Making sure you're thinking about your form. So I'm having to work really hard right now at sitting straight and not crossing my legs and doing things that might hurt. So in that third trimester is when you might start to feel some of those aches and pains a little bit more. And it's really important to listen to your body. Hydration is going to be incredibly important throughout your whole pregnancy. Protein is going to be really important throughout your whole pregnancy. And finding that you're getting enough calories. I think a lot of women sometimes are scared to meet their caloric needs. We do need increased caloric needs, because everyone wants to bounce back after baby, and we don't want to even be thinking about that. We want to think about feeling good, having energy to do what we need to do in our day-to-day life. So I recommend partnering with both a perinatal dietitian and with a pelvic floor therapist, because y'all are going to get sick of me saying it needs to be individualized, but it really needs to be individualized. But as a whole, the first and third trimesters, you're going to need a little bit more rest. The second trimester is when I would plan those trips and things, and then just make sure you're listening to your body's cues and really respecting those.